Hello all, my name is Rowan Gosi and I'm going to be presenting obesity. Obesity, it's a global health crisis. The problem that we have is obesity in the United States is beyond epidemic levels. The prompt that I chose was a community in Birmingham, Alabama, has a high prevalence of obesity and requests that a group of nurses provide healthy promotion, healthy education to a high school class to prevent the cycle from continuing. The school lunch program serves typical Southern cuisine, and although they do not have a sports program, an organized physical education program is not part of the curriculum. Obesity is a health crisis among children and adults. Some statistics per the CDC in the year 2013 and 2014, over 37.9% of adults 20 and over are obese. Over 20.6% of adolescents 12 to 19 are obese. Over 17.4% of children 6 to 11 are obese. And 9.4% of children 2 to 5 are obese. Factors that cause obesity include genetic, behavioral, and environmental factors. How does obesity affect the community? Childhood obesity can cause psychosocial, social health problems, and physical issues. Also, there is an increased prevalence of childhood obesity, which has adverse morbidity and mortality rates in the adult life of a child. Obesity can lead to cardiovascular disease, type 2 diabetes, cancer, osteoarthritis, work disability, and sleep apnea as well. Michelle Obama created a plan called Let's Move. She says the physical and emotional health of an entire generation and the economic health and security of our nation is at stake. Let's Move was a plan initiated by the First Lady in order to tackle the issue of childhood obesity. The plan includes information for parents and fostering healthy environments. It includes providing healthier foods in schools, ensuring that all families get access to affordable, healthy foods. And it also ensures that children become more physical active along with their families. As far as learning needs assessments, these students would benefit from knowing about health promotion and obesity in order to evaluate what their learning needs and assessments are. Questions need to be asked about what foods they eat at home and the food served in school. Ask questions about physical activity and how much each student should get and how much they should get. Also, the staff needs to be assessed as far as what health promotion is, because they are the ones providing foods and also providing a healthier environment for these children. Students would need to be taught what causes obesity, such as diet, calorie intake, fat intake, and lack of physical activity. And also the students would need to be taught about ways to prevent obesity through healthy environments, having access to healthy foods, and incorporating physical activity. As far as health promotion, the health promotion model that I chose for this particular prompt is the health belief model. The health belief model would be appropriate for these high school students. Per Clark and Paraska, the health belief model is among the most widely used models for explaining change and maintenance of health behavior, as well as developing health behavior interventions. Now, in relation to obesity, the high school students would benefit greatly from here because they would need to change their bad eating behaviors, as well as incorporate ways to prevent bad eating behaviors and provide good eating behaviors. The goal in preventing obesity amongst the Alabama high school students would be prevention and reducing the severity of those already suffering from obesity. The health belief model will allow the students to look at how they perceive their health behaviors It allows the nurse to predict the student's health behaviors as well as identify barriers to compliance with therapies. Motivation would also come from the health belief model, which occurs when when patients believe the interventions are necessary. As far as health promotion and education plan, the goal for these high school students would be that they would be able to identify and choose healthier meal plans and increase physical activity. The students will be able to identify what causes bad eating behaviors. Through counseling and promoting healthy eating behaviors, the students will be able to promote a change in their diets. Behavioral interventions are strategies to help patients acquire the skills, motivations, and support to change a diet and exercise patterns. The students will also consume healthier diets at school and at home. By using the Let's Move website, students and their families will be able to learn proper diet guidelines and physical activity. The students will be able to increase their physical activity in the school and at home. Per Seguil and Stevens, increased physical activity and the development of fundamental movement skills throughout the school week would contribute in preventing obesity in children and adolescents. As far as research and evidence-based practice, per Mittig et al., they developed a way to screen and treat obesity. So they formed an analytical framework that asks key questions and criteria for obesity through randomized controlled trials and systemic reviews. In conclusion, they found that interventions to prevent obesity, such as behavior and counseling, pharmacotherapy with drugs, and surgical interventions, were ways to prevent and ways of intervention to prevent obesity. The high school students in Alabama would benefit from this through the teaching plan, as they will be able to understand their eating habits through behavior and counseling. According to Riley, through evidence-based practice, they created something called the Planet Health Trial. This Planet Health Trial was deemed to be a successful intervention and prevention method for obesity. It consisted of changes to the school curriculum, such as diet and exercise, changes to school meal provision, and it also targeted reductions in television viewing and the promotion of walking to and from school. Another research was by Seguil and Stevens. They concluded that changes in school curriculum would include healthy eating, physical activity, positive body image. It also meant that environmental and cultural practices were needed in order to provide support for the children in eating healthier throughout the day. So this would mean school-wise, the environment should be positive and providing foods that these children will eat, as well as at home. Also support for teachers and other staff to implement health promotion strategies would be proven successful in allowing these high school students to eat healthier and have better physical activity in order to prevent obesity, as well as their home activities, and encourage children to be more active, eat more nutritious foods, and spend less time in screen-based activities such as watching TV, playing video games, were proven to be successful interventions in preventing obesity. As far as the evaluation plan, what I concluded would be successful would be a survey of questions. These questions should be developed in terms of the education plan, and the questions should be given to the students weekly so they can answer them weekly. Questions asking the students about their diets and what they consumed in the week. Questions asking the students how much physical activity they perform. These answers in relation to the teaching plan would prove if the teaching plan is successful. Also, it would allow the nurse to predict the students' health behaviors when they are eating bad throughout the week, when they're snacking, etc., and also identifying barriers to complying to therapies, why the teaching plan wasn't successful. These survey of questions would allow the nurse to evaluate the plan. In conclusion, it can be said that through proper intervention and prevention, the high school students of Alabama would benefit greatly from the health promotion plan. In teaching and counseling health behaviors, the students will be able to identify their own bad eating habits through proper teaching and diet. The students will be able to incorporate better eating habits, and also increased physical activity would contribute in preventing obesity. Thank you, and that would be all for me today. Thank you.